I just showed an image of our visit to Up Academy Holland last fall. And the reason why I chose that image is because the unofficial motto of the school is "the challenge makes it great." I like that motto. We have faced many, many challenging times together, and the idea of like the challenge making it great, that we, in striving, we have a chance to succeed and to grow. I think for our students and for our staff and for ourselves. My growth area today is that I'm going to try to show a video during this presentation. And so I'm trying to embody this idea of the challenge makes it great, because we're going to see how it goes. If it flops, as it has in the past for me, you can let me know and we will work our way through it. But hopefully you'll be able to both see and hear the video. And I'm going to toggle back and forth between screens. And so, man, we have set a high bar for ourselves today, but hopefully we'll come through just like the kids at Up Academy Holland. Let's go ahead and jump on it. So as always, we've got our team here with you today. On screen, you can see Jeremiah and Lauren and myself. And so many people supporting us and making this happen. And a big shout out right now to Brianna Higgins from Lauren Wu's team, who's helping us with closed captioning. We are working to get a professional closed captioner working with us in the future. And so thanks for everyone for bearing with us. Hopefully we're getting a lot of the main ideas down in the presentation today. So thank you, Brianna. Let's talk about what we're going to try to do together in this hour. First, as we mentioned when we sent you the invitation for today's meeting, we really want to spend some time going over our protocols that we have, that we just recently updated and released this week. We're really pleased that we've invited both school and district leaders here together with us today, along with local board of health representatives. And as always, we have support from DPH with us. And so just really appreciate the chance to dive into this with you, answer questions that you might have about the new protocols. I'm actually going to use the document as the basis for our discussion, because we want you to use that as a tool. And so really just walking through that highlighted version of the protocols document. We also have some great updates about our COVID testing program, a lot of it in response to questions that we heard from you. It's some really key shout outs to different superintendents, the Massachusetts Teachers Association, just different groups that have been in touch with us and helped to make it stronger. And so I'll explain more as we go on through, along with some next steps. But without any further ado, let's just jump right in on the protocols update. And so let's just take a look at what's happened with the protocols this week. Just a quick reminder that our protocols are available at the link that's in the PowerPoint. Lauren will be sharing the PowerPoint with you. And we've had some questions about, hey, when you update these protocols, how do we get them? Just keep in mind that we always send them out through the Commissioner's Weekly Update, through Commissioner Riley's weekly update that goes out every Monday. And so if you're not already signed up for those weekly updates, just please get on the list. We want them to go far and wide so that you get what you need. And some of the key highlights are about the symptoms information that are in the protocols, as well as a really key differentiation between the protocols if you've switched over to our new testing option that includes the at-home antigen test, or if you're staying with our legacy program, our existing testing program, including test and stay and contact tracing. So rather than talking about it, let's go look at it together. So this is my first toggle back and forth. Bear with me. We'll try not to get motion sickness here together. Let's get to the right one. Hold on 1 second as I just do a quick toggle. Nope, it's there. All right. Here we go. This one. All right, Lauren, are you seeing the protocols on the screen?
Yes, we are. You might want to just zoom in a little bit if you can.
Zoom in a bit. Sure, absolutely.
That's great.
Okay. So,
and Russell, just to cut you off quickly, I am going to send this highlighted version in the chat so people can download it straight from the chat.
Great. We appreciate that you rely on this document and the highlighted version sometimes as you explain it to your staff, as you think about it yourselves. But I've really highlighted, and Lauren and I have worked together to really highlight the sections that we think are most relevant and that you need to see the most upfront and explain the changes. So here's a really key one at the beginning, and I want to make sure that everyone hears this and knows about it, is really about symptomatic testing and who symptomatic testing is available for. So a big and important change with our document here that you're seeing in front of you right now is the sentence that says that symptomatic testing is available for vaccinated, unvaccinated, and those who've tested positive for COVID-19 in the last 90 days. We really want our focus to be on symptomatic individuals right now. We think symptomatic testing is just a huge cornerstone to this program. And so making sure it's truly available for everyone is a key thing that we've included in this update. Keeping in mind that what I have in green here is that all other testing program components like pooled testing or the at-home antigen tests, we do not want individuals to participate if they've tested positive for COVID within the last 90 days. Keep in mind that, last week I mentioned that we know it's an imperfect science, so please do your best to figure out who has had COVID within the last 90 days. We're not keeping a list ourselves. We don't know ourselves who has and who hasn't. So we just rely on you to just use the best knowledge you have, the best information you have to figure out who should be getting those take-home tests. So I think those are that key differentiation around symptomatic testing versus all other forms of testing, and who can participate, I think is really important. And then finally, I know how strongly this whole team feels about this, but we always just want to remind you about the availability of the mobile vaccine clinics. I'll be talking about that a little bit at the end of today's presentation. This hasn't changed, this isn't new, but anytime I get to talk about our protocols document, I always just like to remind people that the #1 mitigation strategy is vaccination. And so encouraging you to do everything you can to get those mobile units set up inside your districts to just help get as many shots in arms as we can. Let's look at the next component of this document, which really gets into the symptoms. And like I said, we've done some key work to update the symptoms so that they are consistent with where we're going right now in terms of response to the virus. So in the past, in previous versions, there was a differentiation in symptoms for vaccinated versus unvaccinated individuals. And the new symptoms list, this list you're seeing below here in green, applies to all individuals regardless of their vaccination status. So let's just, I'm not going to read the list to you, but notice that we don't have the bolded top symptoms anymore, no more bolds. But keep in mind that we did keep the idea of certain symptoms, being seen as symptoms of COVID when they're in combination with other symptoms. And then finally, just up here in yellow, that we recommend but don't require a COVID-19 test to return to school. So we think it's a good idea if you're having these symptoms, if a student or staff member goes home with symptoms, that it's wise to have that test before returning, but it's not required. Lauren, Jeremiah, anything that you want to add? Dr. Madoff, anything you want to add about symptoms before I go on?
Nope.
One question, Dr. Madoff, that I might direct to you. There's one that I'll direct to you at the end of the presentation, but nothing to break things up other than that.
Okay, that's fine, Jeremiah, anytime.
Thank you.
Sounds great. Sounds great. Thanks so much. So scrolling down, keep in mind that we have the same section 2 as we had before about the testing and quarantining response protocols. And a really important footnote here that we've highlighted for you is that what constitutes a vaccinated individual. And so what in our schools, fully vaccinated remains. This hasn't changed since the end of December. This was something that we put out there and the updates that we did at the very end of 2021, is that a fully vaccinated individual is defined as having completed the Pfizer or Moderna series or the single dose of the Johnson & Johnson vaccine. So we hope that that's an important footnote. We get a lot of questions about it. We just want to make sure you're seeing that this remains our advice as we go forward with these new protocols. But again, coming back to section 2 and what's in it, remember section 2 contains 3 important protocol categories, and they reference each other throughout. So let's just remind ourselves that protocol A is for individuals who test positive, protocol B is for asymptomatic close contacts, and C is for symptomatic. I often use that as almost a little mnemonic for myself. C is symptomatic. But let's jump in and look at all 3 and any changes there. Starting with individuals who test positive. Again, this hasn't changed dramatically. There's one small change that we'll point out to you right now, but we haven't talked about this with you. We haven't done a webinar specifically on the protocols, I don't think, since the end of December. So this was a change from the end of December. I think you're used to it by now. The idea that the person whose symptoms improve, who's been without fever for 24 hours, can return to school, just, and all the details here, can return after 5 days, again, as long as these conditions are in place. The important thing about this 5-day period when they're coming back, the additional 5 days, is that we do need those individuals to wear masks, and we know that. That's something that I think you've done a great job at implementing, and we appreciate it. But we just wanted to clarify in this particular update to the protocols that the exception for wearing masks is when eating, drinking, or outside. And so the or outside is in yellow here, so that you're seeing that that's an update for this document. Lauren, anything else that you'd want to add about Protocol A?
Nope, I think you got it, Russell.
All right, thanks, Lauren. Protocol B, let's just orient ourselves using those good nonfiction reading strategies, right? We are educators, so we're going to use good reading strategies to see that we have a new version of Protocol B for schools and districts that select the new testing option that includes the at-home tests. So that's kind of the more prominent Protocol B, because so many of our schools and districts have switched over. And then we have the Protocol B that's the legacy version, right? So you need to make sure you're following the right Protocol B for whichever choice your school or district has made. But let's look at what's changed about Protocol B for the districts that have selected the new testing option. So just that reminder that through when you're implementing the new testing option, likely for many of you this week, as soon as the tests start going home with students, and you're sort of cutting over to the new system, that there will not be the need to identify close contacts in schools the same way that we have in the past. And remember, last time we talked about school health professionals still being able to use their discretion. So it's not a prohibition on contact tracing. It's just saying that it's not necessary, particularly with all the other mitigation strategies that we'll have in place. So we know that we have that's not new. That's just a carryover from the discussions we've been having the last many weeks together. But individuals who are identified as close contacts outside of school settings, do need to follow the guidance that the DPH has put out about out-of-school close contacts. And so let's, again, a little further differentiation here. If an individual is in the school setting, asymptomatic and vaccinated, they do remain exempt from testing and quarantine protocols. So important just to wrap our heads around, again, in school, vaccinated, asymptomatic are exempt. But, and I'll come back to that footnote in a minute, unvaccinated individuals who are identified as close contacts outside of school, right? Again, following our overall guidance that anyone would have to follow about being identified as a close contact outside of school. If you are unvaccinated, need to follow this Protocol B that we have listed here. And again, a lot of the same ideas about quarantining, returning after 5 days with the caveats that we have listed here. Note that the mask use, the exemptions are the same as above, of eating, drinking, and then in yellow here, outside. And I think it's just important to just notice that, if they do test positive, if they're designated as a close contact and they become symptomatic, they need to follow Protocol C. And if they test positive, they need to follow Protocol A. So, I think those are all really important points. Lauren, before I go on about the legacy version, of which there's less to say, anything that you want to mention about Protocol B for the districts that have selected the new testing option?
No, Russell, I think you hit everything.
All right, but here's a really important point that we have as a footnote, that we've gotten a lot of questions about how to count the days. This is shifting gears just a little bit in our thinking, but for individuals who are identified as being positive through a pooled test, right? How do you count the 5-day isolation period? When does day 0 begin? So day 0 is the date that the positive test was collected. So, today's Wednesday. If you run your pool testing today, right, you get those pool tests, they go off to the lab and you get the results tomorrow. Tomorrow's not day 0 for anybody who was identified as positive through pool testing. It's today. It's the day that the sample was collected. So we hope that clarification is useful to you. Lauren, this is even a more recent update, so you want to make sure you're using the version of our protocols that's on our website, because I think this is a tweak that we further added even just this week, right?
That's correct. Yep. So if people have are keeping a local copy of the protocols, please go back to our protocols link on our website and re-download the version that's posted on our website.
Great, thanks so much. All right, so we've covered protocol A and B. B, I just wanted to make sure you just are remembering that if you're maintaining close contact tracing, and test and stay, nothing's changed there. So there's not a lot here to cover, except that the one thing that we did just want to highlight is that quarantine is still strongly recommended for individuals who are identified outside of school settings. So we know that, we use test and stay, keep kids coming into school if they're identified as close contacts inside school. If they're identified outside of school, then they do need to quarantine. And I think we're all very used, that's not new, just a reminder there. So we're kind of coming down to the end, but let's take a look at protocol C for symptomatic individuals. And so just a reminder that C applies to vaccinated and unvaccinated individuals. So if you do have symptoms, just like we talked about above, the symptoms apply to everyone, vaccinated or unvaccinated. And the duration, as you can see here, it's a little different. It's not counted by days. It's really about symptom resolution, because again, these are not individuals who have tested positive, they're symptomatic. And so we need to see that improvement in symptoms. The individual needs to be without a fever for 24 hours. And then the recommendation for the PCR test or an antigen test. And I think that or is really important. We have further information about the fact that, a home test, for example, can be used, that you don't have to have the test be proctored or performed by a healthcare professional in order to use the antigen test. I think that's a really important point to make. An alternative diagnosis can also be made. So if a treating physician identifies that the individual has strep or influenza instead of COVID, then that alternative diagnosis can be used in lieu of a PCR or antigen test. Then finally down here, if there are mild symptoms, we can use Binax Now for mild symptoms, and really, Lauren, I think any symptom, right? I mean, it's mild or any symptom. Binax Now that's applied in school, the use of the antigen test that we use in school can be used. If the individual is positive, they need to go home. Obviously, if they're negative, if they have mild symptoms and they're negative, they can remain in school. We just think that's an important thing to point out. So that's really it for what we wanted to cover in the protocols, just pointing out that there is the third section about pool testing protocols. I'm not going to go over that because we're pretty used to that. While I switch back to the presentation, Lauren, let me just pause and see if there's anything important from the Q&A that you want to hit now or anything else that I missed.
Maya, do you want to pose that question to Dr. Madoff?
Sure, thanks. I think, Dr. Madoff, there are just some questions. In fact, there are a number of questions in the chat about the 90-day rule and how that relates to PCR versus antigen testing, and why perhaps allowing newly symptomatic individuals who have been positive in the last 90 days to do an antigen test might be a good idea.
Thanks, Jeremiah, and thanks also to DESE and for inviting me to join today on behalf of DPH, and to all of you for joining us. And I know this is there are lots of questions, and there's a lot going on in this guidance. And I think we're all feeling a little bit of a sense of relief as case numbers go down here in Massachusetts and hospitalizations go down. So hopefully you also are feeling a little bit of this relief, or will soon. So the 90 days is something that's been with us really for many months of the pandemic. And what it relates to is basically the immunity that happens to somebody after they are infected. And during that 90-day window, it's very unlikely for someone to get COVID again, to get reinfected. You can never say never, right? Rare things happen. But as a very good rule, reinfection is highly unlikely during that time period, and asymptomatic reinfection is especially rare. So the other thing that happens during the 90-day window that we've learned through experience during the pandemic is that a PCR test for COVID can remain positive. And it's a very sensitive test. It can detect, just minute fragments of the virus, and that can persist for up to 90 days. And so for that reason, we don't recommend testing. We ask you not to test people with a PCR test during that period of time, because it's a positive result is way more likely to be due to just this persistence of viral pieces during that time period than it is to be due to reinfection. The antigen test is a little better in that respect. It tends not to pick up these just tiny fragments of RNA that the PCR can pick up. But it's really not necessary to test somebody during this period of time, during this 90 days, because it's so unlikely that they're going to get a second infection. The one circumstance where it is warranted to retest somebody is if they're symptomatic during that period. And then, if somebody develops symptoms of COVID, or their clinician thinks that they should be tested for COVID, that is a time. And it's actually a good use of the antigen test during that period, because it will pick up larger amounts of the virus and not be falsely positive just due to a prior infection. But in general, during that time period, people don't get reinfected, and it's why we get over infection, right? If you're infected with a virus and you recover, it's because your body's immune system has cleared the virus, has responded to it, and it's very unlikely that you'll get reinfected during that 90-day period.
Great, thanks so much. Really appreciate that. Really additional context and information that's useful, I think, for everyone to hear. Let's take a look at some of the updates then to our COVID testing program, and particularly just starting with the data. We didn't look at this last week. Oops, sorry. Let's take a look at the data and what it's telling us. So keep in mind that the data here are a little lagging. We are about to release a new report from last week, but we continue to see such an impressive number of tests that are being run. I don't think there are many other places in society where as much testing is occurring, and so really appreciate the work that's being done. That doesn't come without effort and a cost, and we know that you are doing this and making it happen, and we really appreciate it. Jeremiah, do you just want to point out, we have got the pool positivity rate from last week, and you can see what's coming this week?
Yeah, I'd love to. Thank you, Russell. So you can see here, this is actually data from 2 weeks ago, and it's also said the data from last week will be released on Thursday, as it always is, so that's tomorrow. And first of all, that pool positivity rate, I think it's a little below 6% for last week. So that's continuing to trend downwards closer to the average. And then hopefully we'll start bringing that average down again. But the one thing that I just want to draw attention to for folks is that average swabs per pool number. I'm sure you all received communications from us and from CIC back in early January when we were seeing pool positivity rates that were pretty scary with the green light to run smaller pools. Of course, we usually say between 5 and 10 now. If you're on Veritas, it's just 5. But we gave a green light for folks to run pools down to even 2 per pool, just because of the huge amount of positive pools and the reflex testing that was involved there. We are now, I think, as a state in a place where you can start to bring those pool sizes back up. Certainly, your district better than anybody else. So if you are still running a fairly significant number of positives in your pool testing every week, we're not telling you have to bring it up, but we're saying please keep an eye on that positivity rate. And as that positivity rate falls, there is not only a cost, but also a turnaround time impact of having fewer tubes going out into the road. So please just keep an eye on that. Thanks, Russell.
Great, thanks, Jeremiah. Appreciate that. So if in addition to covering the protocols, this next piece that we want to share with you is, I think, one of the most important takeaways from today's presentation. And I just want to give a shout out to Marty O'Shea, the superintendent of Longmeadow, who, among other people, raised this question with us about the use of the at-home tests. And we're listening. We appreciate your feedback, and we've taken it to heart to improve our program. And so, here are some fundamentals to think about. Anybody participating in the at-home testing program will receive the equivalent of 1 test per week. The tests come in kits of 2. And so people will be getting their kits every other week, and the kits will cover them for 2 weeks. And so how do we use those tests during the 2 weeks? Overall, we imagine that you're going to identify a day of the week that you want individuals participating to take the test. So let's just say today's Wednesday. You tell your staff and students, let's all take the test on Wednesday. That's a good starting point, right? Because that's how we said we're going to use this test is for surveillance purposes and, kind of aligning around getting any positive results back in a timely way, and just to use it to, have that surveillance of what's happening with the virus in our schools. But one of the questions that we received from you was, well, what about somebody who becomes symptomatic during that period, let's just pick that week, right? They've got one test to use during the week. What if they become symptomatic during the week? What could schools tell parents? Couldn't they tell them to use the test out of cycle, maybe on a Tuesday or, a Monday? If the student actually shows symptoms earlier in the week, for example, before the date that you had set for testing. And we think that's a great idea. We think that, you should actually message that to your families to say, our focus is definitely on wanting to, really be looking at individuals with symptoms. And so use these tests for surveillance as much as we can, but, let's not, if we're seeing symptoms, we want to respond to symptoms, and let's use a tool that we have to do so. We don't have more tests though to provide you. So once the parent uses, for example, let's just use that scenario of a child and a parent being informed that they can use the at-home test for their symptomatic child, they wouldn't then have another test to use later in the week for surveillance purposes. They would, be, sort of using that one test that they have per week for a symptomatic child instead of for surveillance later in the week, as an example. This does a lot of things though. This it certainly expanded my thinking about how various components of our testing program can fit together. So let's just imagine there's a scenario where a student is symptomatic in school and tests the school nurse maybe or someone else conducts a Binax Now test in school. The student is negative and goes home. That parent could be encouraged then to wait 2 days, a day or two. If the symptoms are persisting, actually, if they're negative, they would stay in school. But at the end of the day, when they go home, the school health professional could reach out to the parent and say, hey, how about tomorrow or the next day, use that one test that you have to just, stay on top of this, because we know that testing once a symptomatic individual could change over a period of a few days. And so how you combine symptomatic in-school testing with using the at-home test for symptomatic purposes, I think gives you even more coverage of symptomatic individuals. So we're pretty excited to bring this to you today, to be thinking about this, and just really encourage you to think about how you're messaging that, because it could be a little complicated for families. Use it on Wednesday unless you have symptoms, and how much do you want to be involved in and helping families with that, I think, is something that we'll rely on you to work out and to communicate. But we do hope that that's helpful for kind of clarifying that piece, and we appreciate the questions that we got on that. So again, if you are using the at-home test for symptomatic individuals, keep in mind that protocol C, again, C is symptomatic. So protocol C for symptomatic individuals says that it's recommended to receive a negative PCR or rapid antigen test. So yes, this at-home test could be used for that purpose if it's available and desired to be able to do so. And then, just like I said before, just want to double down on this idea, though, that we don't have additional tests available right now, to use for both symptomatic and surveillance purposes. But we just think that, common sense should dictate that the use of the test for a symptomatic individual could be a good thing. As a dad, I know my son often had a runny nose. It's just helpful to, just be able to check on that, use this test for that purpose as necessary. But because this is such an important topic, Lauren, Jeremiah, anything that you want to kind of jump in and add here?
Yeah, I think this is right, Russell. We have had a couple of questions about what constitutes a mild symptom, and we have answered that previously in an FAQ. And so I want to direct people to go back to that FAQ. I know we're having some issues with the documents in the chat, so I will send out to all of the people on this webinar. We did ask for registration, so I will be sending out the highlighted copies of the protocols and these slides, and I can also direct people to the FAQ, which describes what are mild symptoms.
Thanks, Lauren. Appreciate that. So glad to see if there are other questions about this at the end, but we hope that that's helpful. And again, it's very responsive to questions that we received from all of you. Also, what I want to shift now to, though, is talking about our work with families to increase the participation, increase the number of students that we have participating in the at-home piece, and what we can do to support that. Keep in mind, I just want to reiterate one more time that opt-in is different than consent, right? Consent is a legal process and it requires a parent's either e-signature or wet signature in order to make it official. Opt-in is a bit more flexible. And so, yes, we want to make sure that parents are actively opting in, actively choosing to do this. Having a form is a great way of getting that done. But you could also have a verbal conversation with a parent. The parent tells you they want to opt in. And as long as you follow up in writing with the parent to what they've opted into, right, so that there is documentation of it. And it could be just sort of taking what is already in the form that the district is using and just turning that around as a reminder to the parent of what they've opted into is fine. That's acceptable. And so really would encourage everyone to get behind, how do we talk to families about this? How do we encourage educators and administrators and really anyone within the school community just to, talk it up, get interest going, and, verbal opt-in followed up with written documentation is completely acceptable. Also very much appreciate that the Shaw Family Foundation has created supports to help you with this. And so just want to remind you that there is a Google form that's available in multiple languages from the Shaw Foundation that just takes the opt-in form and makes it available in Google Forms. It's an optional resource. And one of the things that I know that the Shaw team really wanted to clarify for you is that it immediately comes with it. If you use their Google form, it immediately comes with directions on how to remove the Shaw Family Foundation from access, so that there is no further kind of ties to the Shaw Family Foundation if you use their form. And I think we're pretty used to that with using Google, that who has access and how you limit access is pretty well known. And so there's a lot of transparency around that, around who has access and who doesn't. So we just encourage you to take a look at that. If you have questions, if you want access to that, please don't hesitate to use the email that you see at the bottom of this slide to reach out to the Shaw Family Foundation. Marisa, anything that I missed there? Anything that you'd want me to add?
Thanks, Russell. Nothing to add there.
All right, thanks, Marisa. Speaking of families and working with families, one of the pieces of feedback that we got after our webinar last week was just making sure that we elevated where the information about the written instructions about using the at-home tests for families could be found. And so while it does exist in the letter that families have access to, we wanted to make sure it was just prominent on our webpage. And so here's the link on this slide to our webpage, our COVID testing website. And then this is an image from the page, just so that you know where to go to look for, where it says, click here for full how-to written guide in multiple languages. That's the piece that we hope that you will go in, download, and really, it's like a flyer with, easy graphics to follow about administering the iHealth test at home. And so again, we just hope that you'll go there, get whatever language versions you need, and really help to get them out to families this week, because we know that you're going to be distributing kits to students this week. We want to make sure that when they get home, parents know what to do with them, parents know how to use them. And so, we think that having access to the written information that is very graphically based will be really useful. And anything that you can do, again, to help parents feel comfortable and familiar with the tests before they administer them, any type of parent sessions you might offer, I'm sure will go a long way to just increase how these tests get used. So let us know if you have any good ideas on that, anything that we can share and promote about getting the word out to families about not only opting in, but then also using the tests and using them well. We really appreciate your support with that. So again, just in terms of updates to the testing program and key things that we want you to be thinking about, the at-home test all relies on ordering and distribution, right? You giving us the numbers of how many tests you need and us getting them out to you. And I'm really pleased that, we were able to get so many staff tests out last week. And this week, as you know, we're getting those student deliveries out. So here we are in this week, the week of the 31st, you know that you're getting your student deliveries this week. As I emailed to each of our contacts for our COVID testing program this morning, you either should have received your shipment or notification that the shipment is on its way. The shipment confirmation, just like you're ordering something on Amazon, There should be an email coming to you letting you know that it's on its way and when to expect it. Sometimes it goes to your spam, so please check your spam. So we know that's on its way. The other thing that I really want to point to is that today is the day, by close of business, that we need to know what quantity of staff tests you need delivered next week, right? So today is the day. If you haven't done it yet, please make sure that the staff quantity is correct. And I'll say a little bit more about that in a minute. And then the other thing that I want to point out on our calendar is next week. Let's look ahead to next Wednesday. And a little shout out to Superintendent Brandy Kwong of Methuen, who pointed out to us that next week is we need to make sure you have both your staff and your student quantities right, because the week of the 14th, the week before February break, we want to make sure you have all of the staff and student tests you need to get you through this week, the week of the 14th, and to be ready for the break. And next week, I anticipate we'll come back with another webinar with ideas about advice that you would give to your families and staff about using the tests during February break. But in the meantime, just try to be very cognizant of these deadlines because they are real. We need to stick with them to make sure that we get you your deliveries on time. So today, make sure your quantities are updated for your staff. And next week, both staff and student quantities need to be updated so that we ship both the week of the 14th. So I've already gone over this, but again, today's the day for your staff numbers. Next week, student and staff numbers. I actually didn't update this slide after Superintendent Kwong reached out to us. And again, gratitude to her for that. But it is student and staff next week. If the numbers haven't changed, right? So we've had a lot of questions about this. Whatever numbers you enter, we're going to continue to ship to you all throughout the rest of the winter and early spring. As long as we're doing this, you're going to get whatever number is in our system. So if you've entered your staff numbers and they're stable, if you've entered your student numbers and they're stable, you don't need to do anything. Just check to make sure that they're still there from time to time. Maybe nothing funny's happened. We don't think that there will be, but you don't need to do anything. If the numbers have changed, if they've increased or decreased, if you start to sit on a lot of at-home tests that you just haven't gotten out the door just yet, you could decrease your next shipment because we know that storage is an issue inside our schools. And so if the numbers change, then you need to start to update. But now that we've gotten past the first cycle of entering the staff numbers and the student numbers into the CIC ordering portal, there's nothing you need to do if the numbers stay consistent, and you only need to go into the portal if they change. So we do have directions on this slide for using the what we call the CIC Health Supply Form. I've been sometimes calling it a portal. It's the same thing. The CIC Health Supply Form, that's where you go to order. I did appreciate when I put out the email today to remind people to use this. I got a couple of emails back saying, I'll take 45 tests. And I appreciate the rapid response to me, but keep in mind that emailing me is not going to get it into the CIC Health Supply Form. And so please use that form. It's pretty straightforward how to use it from those directions. But here's, again, where I reached the challenging part of today's presentation. I'm going to try to briefly share with you a video about how to how to input those numbers. Let me just share my screen one more time. I'm going to share my sound so that we can hear the video and go over to this screen and pop over here and hit play.
Hi, I'm Brian Donnelly, and
I'm going to pause. Lauren, can you hear that?
Yes, we can. Great.
All right. Tell me if
go into full screen mode.
You got it.
So you can see better. But yeah.
Thank you. Yeah. And if I need to increase the volume, please just let me know. Maybe I'll just check that quick. There we go. All right, let's just go with it.
I just wanted to show you how you can ensure that you have the right data in our systems to properly participate in the at-home antigen testing program that Massachusetts has rolled out this week. So step one is absolutely to fill out the intake form that the Department of Elementary and Secondary Education has posted to their website so that you can be admitted to the program. Once you're in, you can go to the CIC Health portal, navigate here to the school and consent database, and you'll see then your normal view of districts, schools, consent, permissions, and supplies. If you click on the supplies button right here, you'll then see that you can order supplies as you normally do now. You'll see a new option as well to update your at-home antigen test participation numbers. So if you click on that button, you'll see the districts that have opted in so far, the districts that you might be responsible for who have not yet opted in. If you need to enter numbers for this district, you need to start by, again, going back to the intake form that the state has provided. You then can see the latest numbers that have been input for staff and students for each of the districts that you're responsible for that are opted in. And if you need to update those, you can click on this button to add or update opt-in numbers. When you click on that, you'll see a district dropdown. Choose the district that you want to update, enter your full name, and then enter your staff estimate and your student estimate. And you'll see that I've gotten an error message now that says that the value that I've entered is greater than 130% of our population on record. This is to eliminate issues where people just sort of enter the wrong number by mistake. So if I then edit that to say that my staff estimate is 80 and my student estimate is 100, those error messages will go away, and I can then submit that, and it will update the numbers to the latest numbers that I've input here. You can see who has last submitted that. This is just a test account, so you'll see Anthony Vargas's email address here, as well as a timestamp for when it was last edited. So you can see that the last edit for the row above here was from 4:44 p.m., and then the one that I just edited here was from 5:35 p.m. So you can come in here at any point and change and update those numbers to reflect your latest numbers. So again, let's say that you have all 80 staff members, but you've had some people come into the program, and so you can then update that and click submit and submit those new numbers to the program. So these orders then will be shipped to you on a regular basis without you having to do anything at all. And again, then you can also review the training material here that leads you to the article that will give you step-by-step instructions. Thanks for listening, and looking forward to the
There we go. So we hope that's helpful just to take a look at that. We have gotten a lot of questions about exactly how to use the ordering portal. Most of you, it seems like, you've got it down. It's becoming old hat now, but just in case there were some outstanding questions there, we just wanted to take a brief look at that video together. Let's go back to the slides one more time. This is my last toggle, so thanks for bearing with me. Make sure that I'm in presentation mode. One more time with gusto. Lauren, how does that look?
Looks great.
All right. So we already mentioned that you should be getting tracking orders, tracking numbers when you order. And so when do they come? Those you will get a tracking. You'll get tracking information when the tests leave the warehouse. So and it's sent from CIC Health from their support email address. And like I mentioned before, just check your spam to make sure that you receive them, that you got that message just in case you're missing it. And they're mainly coming via UPS. So again, we order a lot on UPS these days, so you're kind of used to that, knowing what that information looks like. And just keep in mind that someone has to be available to sign for the tests. Now, we did get a lot of questions last week. So I mentioned last week that I sent out an email myself to every contact that we have for the testing program and said, it was, what was that, Thursday last week, that we wanted to make sure that everyone had absolutely received their tests for staff. And while I got the vast majority were people who said, we got it, we're all set, there were a few questions, and it did raise the kind of concern for me of almost like when I got into a fender bender when I was a teenager, and my dad would ask me, well, when were you going to tell me that happened? And I felt a little bit the same way last week, with all due respect of, we don't want you to be out there suffering. We don't want you to be out there worrying. If you have any question about receiving your orders on time, don't suffer alone. Please let us know. So, you see the schedule of deliveries. We know when we're getting our deliveries coming. And we want to make sure that you have your delivery in time for, no later than Thursday and as early in the week as possible. But we know that if you get them on Friday, it's going to be really hard to break down all the kits and get them out to the schools and get them into students' hands, get them into staff hands to go into the weekend. That's hard to get done in one day if you don't get the test until Friday. So we're working really hard to make sure you get those tests as early within the week as possible. If it gets to be Wednesday and you haven't gotten your order confirmation yet or your order, right? If you have any concerns at all, please email the support@CIC address that you see there. Let us know. Don't wait till it's too late. We don't want you out there worrying. This is what we do. We want to help you. We want to make sure this works. And so please be proactive, reach out, let us know. By and large, we're not seeing a lot of glitches. It really is working, which is great. But again, funny things happen, and it's a very imperfect world. It's all reliant on humans. We make mistakes. And so if there are any little glitches, just please let us know. And by all means, just take that motto of, we, between DESE, HHS, and CIC, do not want you worrying alone. Please reach out to us. We have had just some very minor issues around test security, but just a reminder that, these are products that could be sold elsewhere, and so they do need to be kept secure. And so I already mentioned that the tests have to be signed for when they're dropped off, when they're delivered to you. And if there is a way to make sure that they're kept in a secure location where there has to be a log of who has access to that secure location, I think is really important. And then just making sure that there's sort of a tracking the inventory once they're delivered to you, how you're getting them out to school, how you're tracking your inventory is really important too, because it would be pretty easy to lose sight of some boxes or what goes where. And so if you could keep close tabs on your inventory and where it's going to help cut down on any consternation of people who don't get the tests that they need and deserve. So just a couple of final other notes. We mentioned this last week, but we just wanted to come back to this again to say that, CIC health staff are very much available to help you with the internal distribution of these at-home tests. And so keep in mind that, we're helping to support the opt-in forms, helping to support the distribution of the tests. That's what they are geared up and ready to do. Please talk to your program coordinator if you need ideas on how to use the staff to get them, participating with you in this so that, it's as seamless as possible. They're ready to help, and really appreciate their adaptability with this new program. One final thing to talk about as it relates to our testing program is some of you, not all, but some of you still have the at-home Binax Now tests. If you were doing test and stay, and if you had students who needed to do test and stay to participate in an extracurricular on the weekend. So sometimes we call these the eMed tests. You probably don't have a lot of them, but if you do, you actually can substitute your Binax Now at-home tests for iHealth so that you can just get them out of your schools. You don't need to be sitting on them. They actually very much can be used. It's the same type of thing. It's a rapid antigen test. We know the quality of Binax Now, so we're just glad to have them used. So, if you have them and you're no longer using them for test and stay, please, consider substituting them into your inventory of iHealth tests to get them out. But just keep in mind the Binax Now come 1 to a box and iHealth comes 2 to a box. And so just thinking about, the number of tests that you're giving out will be important that way. And then, finally, really, really, really importantly, because the way in which the expiration dates is set up for the home tests, Binax Now home and in school, can be a little confusing, right? Because Abbott Labs thankfully keeps extending the expiration dates for the tests. And so it means they're still good, they're still active, they're still valid. But the date that's printed on the test kit itself that reads as an expiration date is likely no longer the true expiration date. And when you're putting those into the hands of staff or families, the first thing that they're going to look at is that date, and it's going to seem like the test has expired. And so please make sure that you're using the link to the updated expiration dates, which we have on our website. It's really easy to look up the test by lot number to see what the new expiration date is. We are not shipping things to you that are expired whatsoever, but as you're sitting on the tests, as we're making this transition, you've maybe got sort of a backlog or an inventory of these at-home tests. Just make sure that they are definitely not expired. And then when you're setting them out, you might need to put something on the test itself that reminds people that the test is not expired, because it's really easy to jump to conclusions, and it's understandable why that happens, because at face value, they do look to be expired, even though they're not. So just if you're using them, make sure that you're communicating well what the true expiration date is. Finally, let's look at just some next steps real quick and then go to questions. We already talked about the calendar and what needs to be done when. Today, again, that deadline for your staff orders, make sure they're in. We don't want to have any issues there. CIC has actually reached out to every school or district that have put in zeros so far, where there was no ordering, in addition to the email reminder that I sent this morning. So hopefully we're covered. Hopefully you've gotten your next round of staff orders in. Looking ahead to next week, both staff and students, like I already mentioned. I won't go back over this slide in the interest of time. And then finally, I just want to give a shout out to the MTA, the Massachusetts Teachers Association, and a really good meeting that we had together yesterday. We always want to make sure in every single one of these meetings that we talk about the mobile vaccine units, that they're available, that we want you to take advantage of them. And a really good aha that we had collectively together yesterday was, I don't ever want this to become wallpaper in our meetings. Vaccines are the #1 mitigation strategy. And so what I hope to do in upcoming meetings is to talk to you about what are some really good strategies that districts have used to have a very effective and well-attended on-site vaccine clinic. And if you have ideas, I'd love it if you put it in the Q&A right now. Just share with us like what's been working to get a vaccine program off the ground, who was involved, how did educators, administrators, health professionals all come together to make a vaccine program work. We hope to spend some more time on this in upcoming webinars. We think it's really important. And so while we've always reminded you about access to the mobile vaccine clinics, we want to double down on, well, how do we make them work? And so really appreciate the collaboration that we're having on this, and look forward to seeing where we can take it together. And then finally, just always a reminder of the links that we have available for where you can get information, and then how to get support if you need it through both CIC and DESE and the Shaw Foundation. Lots of places to turn for support. So Lauren, glad to turn it over to see what further questions we have for today.
Sure. I'm actually gonna, Dr. Madoff, if I could give you this one. There were a lot of questions about how to treat close contacts from the household, and whether, if you could just explain what to do with those close contacts.
Sure. Thanks, Lauren, and thanks again for all of you for listening here today. So close contacts in the home are, they're under the jurisdiction of the local Board of Health, first of all, and so they should be handling this and be informed about it. And remember that close contacts are only need to be quarantined if they are not fully vaccinated and boosted. So if they're not up to date in their vaccination. And so this guidance applies to people who do have a close contact in the home. And these are still considered close contacts. Those people would, if they're not up to date in their vaccines, be quarantined for 5 days and be masked for an additional 5 days after that in general.
And just to let people know, we are going to be releasing an FAQ that addresses that specifically. And so people can look for that coming in the next few days. So Russell, there were a few questions about students returning from isolation or quarantine who cannot mask. And the guidance that I've been giving to the people in the chat is that we do recommend that you call our rapid response helpline, since every case is unique and student populations are unique in each district. And we do recommend that you call a rapid response line so that we can walk through the specific situations with the students in your district and in your classrooms, and provide you with some recommendations and guidance for those particular students. I don't know, Russell, if you have anything else to add to that.
No, Lauren, I appreciate that. I assume people know how to access that phone number, but 781-338-3500.
Great. We did have some questions about wanting to know if districts can adopt more restrictive testing requirements. So can they request students or staff to test on day 6 before they return?
So a lot of the, some of this is uncharted territory, and so there are a lot of facts that go along with this. In general, if particularly your local board of health is requiring additional public health mitigation strategies, a student tests positive. So for example, we're hearing about examples where students who are coming back on day 6, as long as there's parent permission, right? Parents have to consent, are conducting testing on site. So they're doing a rapid antigen test. They're not using our testing materials for this, Lauren, right? That's not how our test is meant to be. Our tests are meant to be used because they're not symptomatic, right? If they're still symptomatic, they need to stay home. But non-symptomatic individuals who are coming into school and parents have consented, right, for testing, and they test positive, then the students do need to go home, because from a public health perspective, yes, they are positive with COVID and they need to go home. But if you were telling parents that that they could, in our minds, and again, there's a lot of specific facts here that get into some real critical legalities, but in broad brushstrokes, we would say you can't tell parents that they absolutely cannot come to school if they don't comply, because that access to school is something that we have to make sure that we continue to guarantee on an individual level. But where there's consent and you're doing more testing in school, we have no issue with it. I know that there are a lot of other permutations there, so maybe just start with broad brushstrokes there, and then follow up with your legal counsel around the steps that you can take.
Great. I do think that we answered a lot of the questions in the chat. And so I'm just looking through. I don't know if any of the panelists here, Marisa, or you, Russell, see anything that's sticking out that you want to make sure to answer live.
No, I honestly haven't been looking as closely to the questions, so I apologize that
That's okay. Yeah, no, so we're going to take all the questions, anything that came up, we'll go through them, scan them, we'll add them to an FAQ if we need to. And again, I will respond to the people that have participated in this webinar with the highlighted version of the protocols. And you'll also get the links to the slide, and we will be posting the materials on our testing website as well.
Thanks so much, everyone. Really appreciate your time. Thank you, Dr. Madoff. Thank you, panelists, and we'll look forward to seeing you likely next week. Like I said, we want to come back with more information as we continue to listen to your questions and listen to your feedback to make the program even better. The challenge makes it great. That was the motto we started with. So let's continue to embrace the challenge and have a great rest of the afternoon. Take good care.